Hi guys, welcome back to my channel. In today's Sickle Cell Sunday, I'm going to be discussing some of the medications that I'm on to treat my sickle cell. As I've stated before, sickle cell disease does not have a cure yet, so they prescribe these medications to me so I can live a little bit more comfortably and go on with my life as normal as possible. The first medications I'm going to discuss are some generic over-the-counter medications that I take to kind of help me alleviate minor symptoms. So the first one I have here is this acetaminophen, which is your basic Tylenol, and I have the big jar from Costco. The milligrams are 500 milligrams in each capsule, and I usually just take 2. So usually for the Tylenol, I'll take that to relieve any minor symptoms, like I said, so such as headaches that I might get, or I also use it to relieve some fevers, some pains. Sometimes I do get a lot of high fevers, and the Tylenol is there to help me alleviate that, as well as any minor like pains that I might have that don't necessarily require pain medication or severe pain treatments. And then the next one I have here is this naproxen sodium tablet, 220 milligrams, and this is a anti-inflammatory. So the naproxen works as a non-steroidal anti-inflammatory drug. This is supposed to help you with any swelling you may have in your joints. This is also to alleviate any pain in your joints. So I do have a knee problem and a hip problem, so I take this naproxen to help me alleviate that. This is one of the few anti-inflammatories that actually work for me. I have tried ibuprofen, but the ibuprofen I feel like doesn't work as well as the naproxen. For the naproxen, I take 2 tablets a day depending on how my pains are. I don't take this every day because I don't want it to affect my liver and any other organs, but I do take this occasionally, and I do take this to help me alleviate any pain that I have from the AVN, or the avascular necrosis. Oh, also I use this to alleviate any back pains I have. I do have a lot of back and hip pains, so that really helps with those pains. So the next medication I have here is the ibuprofen, and this is your basic Motrin. This is another non-steroidal anti-inflammatory drug. So with this, I could either only take the naproxen or the Motrin, and most of the time I do opt out and take the naproxen because I do feel like it's a little bit stronger and it really helps me control my joint pains a lot better than Motrin. But sometimes if I do run out of the naproxen and I don't have the naproxen, I will go ahead and take this Motrin. So again, if I have super high fevers, sometimes I get a lot of pain from those fevers, so I'll go ahead and take a Motrin or sometimes a naproxen depending on which ones I have. But it's important to know that you can only take either Motrin or naproxen. You cannot take them together because it can have very serious side effects. You also have to take this with food. It can really upset your stomach, so make sure if you do take any of these anti-inflammatories that you take these medications with food. Most medications you really have to take with food, but these ones are especially important to make sure you get a good meal in before. So I do live in California, and we have a lot of nature out here, and I get really bad allergy attacks. So the allergy pill I take is the Loratadine, and this is an antihistamine, and it's a 10 milligram. So my eyes will get really itchy and I'll just get really bad allergy attacks, so I'll go ahead and take this. Now I don't take this every single day of my life, but I'll take it when I get those really bad allergy symptoms like hay fever and stuff like that. So the next medication I have here is the Pro Air. This is an albuterol sulfate inhalation aerosol, and this is a inhaler for my asthma. So since birth, I pretty much have had asthma, and this really helps me control my asthma attacks. Or if I get a little wheezing in my chest, I'll go ahead and take a pump of this. Usually all I need is a pump for an entire day and I'll be good and nice and clear in my chest. And that's what I take for my asthma. So the next medication I have here is this folic acid, 800 mcgs, and I take this to help me with my anemia, and it also helps you create red blood cells. So this is an important vitamin for sickle cell patients to take because it'll help them rebuild those red blood cells. So now I'm going to move into my prescribed medications that my doctor has prescribed for me in order to help treat my sickle cell. Like I mentioned before, sickle cell doesn't have a cure, so you need to take some medications in order to help you with any issues that are caused by those sickle cells. So the main one that I take to help treat my sickle cell is the hydroxyurea, and it's a 500 milligram capsule, and I take this 3 times a day, so 3 pills. And the hydroxyurea is supposed to help you increase your fetal hemoglobin and really help you avoid any further crisis. So this is a chemotherapy drug, unfortunately, and they also call this Hydrea. The downsides of this medication is that it can decrease the bone marrow function. It can lead to a lower number in the white blood cell count, as well as red blood cells and platelets. This can decrease your body's ability to fight off any infections, so you are more prone to receiving infections or catching infections such as like a common cold and anything like that. In my personal experience, I really have noticed that I catch pretty much anything. If my neighbor, if my dog, if my family members, anyone has a flu or a cold, a common cold, I will then have caught that cold, and I will have those cold-like symptoms for an entire month at least. And then I'll get a sickle cell crisis along with it. With the inability to fight off infections, this is what kind of led me to be prone to acute chest syndromes. Those are kind of the negatives of the medication, but there are some positives, and I'll read you them real quick. And it says this medication is used in people with sickle cell anemia to reduce the number of painful crises caused by the disease, and it also reduces the need of blood transfusions. So that is pretty much the main points of Hydrea. This is a very powerful medication. It is a chemotherapy drug or a chemotherapy agent. It is used to treat certain types of skin cancer. It is used to treat certain types of leukemia and stuff like that. So it is a very strong drug. This medication, it is so strong that it really makes me very nauseous. So I have to take some nausea medication for me to even stomach this medication down, and it is called Ganesintron. But that medication is basically to help me control my nausea, and as well as if I feel like I need to throw up, it'll help me control that. The Ganesintron really helps me control those side effects that I get from the Hydrea. So next I'm gonna go into my pain medications that I take for my sickle cell. Sickle cell causes a lot of painful crisis due to the fact that the cells are misshapen, or they're shaped like a sickle, and so the cells will start clinging to each other in the veins and will clot in certain parts of the body. So therefore it causes extreme pain in the body. In order to help those painful crises, I do take my pain medication, which is my morphine sulfate 15 milligrams. So my doctor has told me that I can take 1 to 2 tablets every 4 hours as long as I have pain. So that's one of the medications. And then I have my morphine extended release. So with the immediate release, this is supposed to help you with those painful crises and with that immediate pain that one can get. So if the pain is very sudden and immediate, I'll go ahead and take the immediate release. So the extended release, I take 1 tablet every 8 hours. So that could be 3 times a day with pain, and that is supposed to help me get through the night and sleep comfortably. So the way the extended release works is that it'll release a little bit of the morphine little by little, and therefore that's why it's called extended release. So it's kind of giving you little doses of that medication, and it's supposed to last you through longer periods and control that pain. And one final thing I have here is Gatorade. Gatorade is not a medication. It's obviously, you know, Gatorade, but I definitely recommend taking Gatorade if you are feeling dehydrated. I know a lot of sickle cell patients out there get very severely dehydrated sometimes, and so Gatorade is like an at-home IV fluid. So instead of going to the hospital and dealing with dehydration, you can deal with dehydration at home. Drink a lot of water as well as your Gatorade. And as you can see, I finished this one. I just have a little bit left in there. And it's very important that sickle cell patients, or anyone, you know, any normal human being, gets their required amounts of hydration in their body. So anyways, guys, those are the medications that I am currently taking. And like I mentioned before, some of these medications were prescribed to me by my doctor, and I am just sharing what is working for me. You know, this is my journey with sickle cell. Not everyone who has sickle cell takes these medications or is on all of these medications. Everyone who has sickle cell, their sickle cell is very different, and everyone is unique. So just because some of these drugs may work for me, they may not work for you. So it is very important that you go to a healthcare professional or your doctor and discuss what are your needs, and you know, therefore the doctor can give you your medication that you need. I have seen a couple of other sickle cell warriors out there who have completely different medications than I do. So take this with a grain of salt. I'm just showing you my journey and kind of what's working for me right now. So I hope you guys enjoyed this video. I hope you learned a little bit of what medications a sickle cell warrior can take. And also, like I mentioned before, I'm not recommending any of these medications. This is just what I am taking because a healthcare provider prescribed them for me. And I hope you enjoyed this video. Please like, comment, or subscribe. Leave me any comments below if you have any further questions on either any sickle cell related questions or on the medications that I have discussed. And please remember to follow me on my Facebook, Instagram, and Snapchat. I will leave all of those social medias down below and list the links down in the description box. Anyways, guys, thank you so much for watching, and I'll see you in the next video. Bye, guys.